Hello, welcome. I'm Sophie Yang, a research assistant working with Dr. Lillian Hung, and we are from Vancouver, Canada. We're presenting on staff resilience, a COVID-19 outbreak in a long-term care home. Now, as many of you are aware, long-term care staff have often been put in a negative light during COVID. But from our interviews, it was clear the staff really wanted to highlight their resilience during this time and their positive stories. So we hope to bring attention to their perspectives. As part of our larger project called Happy to Eat, we had telephone interviews for staff in one long-term care home in Vancouver area. Now, they had just finished going through an outbreak, so we asked them, what was it like for you to care for the residents during this time? And we found 4 themes that were common to their experiences. Now, the number 1 theme that we found was we are proud. Staff were really proud, number 1, of their resilience, and number 2, of the work that they do. Now, this one person said, I always tell my coworkers, we signed up for this job. This is actual nursing. Before the pandemic, we just thought it's good pay, we have job openings. That's why I took nursing. But right now, it's a passion. Now, this other staff member, it's not shown here, but they said, yes, it was exhausting. But the one thing we can say is that if anything comes up in the future, we are prepared to tackle any challenge. Yes, it's interesting that they use the words a good experience to talk about the outbreak, because we know that reframing negative experiences into a learning opportunity does help boost resilience. Number 2, we felt anxious. Now, one staff member said, it's like we had a fear inside because we have families too, and we have other residents. And then this other staff member said it was very stressful. I would leave there some days with my heart broken because I'm thinking about these poor people. They're stuck in a 5 by 5 foot room, and I could leave and had freedom while they didn't have freedom. And so it's really clear that the risks to their safety and the demands of their job, and also seeing the suffering of the residents, really did impact the mental health of these staff members. Now, number 3, we grew closer together. Now, staff, first of all, strengthened relationships with other staff members, and they also strengthened their relationships with residents. This person says more staff makes everything smoother and everyone was taken care of. We had more time to interact with the residents. Because of infection control, staff were kept in the same units, and they mentioned this built a sense of community. Additionally, there was additional staffing provided to meet the demands of the outbreak, and this provided the opportunity to spend more one-on-one time with residents. For example, especially during meal times when they had to feed the residents. And this is an important finding because we know that human connection helps boost resilience. So it's interesting that they really chose to highlight how they feel closer to one another during this time. Number 4, the vaccines helped. Now, right before the outbreak, most of the residents and the staff were able to get vaccinated or partially vaccinated. And this was in the beginning of this year. So this person says, you have peace of mind that you're protected. It gives you confidence. And they were very grateful for this. Now, our point in all of this is not to dismiss the suffering that has happened in long-term care, but rather it's to bring attention to the resilience, to the strengths, and to the positive stories that the staff that we talked to were so eager to share. So if you'd like to learn more about their experiences, then you can read our preprint, which is linked right here, or you can see the Idea Lab website. And Idea Lab stands for Innovation in Dementia and Aging, and that's our research team. So we hope that this message really resonates with you, and we hope that you enjoy the rest of your conference. Bye bye.